If you're in business, you probably have a website, but can your site handle your growth? How many visitors before your site slows down or crashes? What about storage and data security? From web hosting to virtual servers, Pair Networks provides the online infrastructure you need to start, grow, and flourish. When it comes to security and updates, don't worry, we've got you covered. Our 24/7 US-based customer support is the best in the industry. No frustrating chatbots or sitting on hold for hours. Check out pair.com today to learn more. That's PAIR.com.
Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
Hello, everyone, and glad you can attend this week's Attitude Experts webinar. I think today's topic is relevant to all of us, parents raising a child with ADHD or adults living with the condition. We all know how important high-quality sleep is for optimizing the brain and managing symptoms. We also know how difficult it is to achieve. Doctors Joel Nigg and Elizabeth Super will discuss the science behind the link between sleep challenges and the ADHD brain. They will also talk about the special challenges teens with ADHD face when it comes to sleep. And most importantly, they'll give us strategies and solutions to tackle those sleep challenges. First, though, today's webinar sponsor is Sonic Alert, maker of the Sonic Bomb alarm clock. Never sleep past your alarm clock again with this extra loud alarm and powerful bed shaker. The dual alarm clock has been proven to wake up even the heaviest sleepers. If you want more information about that, go to sonicalert.com/alarm-clocks. Just so you know, Attitude webinar sponsors have no role in the selection of guest speakers, the speaker's presentation, or any other aspect of the webinar production. Now let me introduce Dr. Nigg and Dr. Super. Joel is a professor in psychiatry and behavioral neuroscience at Oregon Health and Science University. He's the author of a wonderful book called Getting Ahead of ADHD and a regular contributor to Attitude Magazine. Elizabeth is an associate professor in the Division of Pediatric Pulmonology and Sleep Medicine at Oregon Health and Science University. She has practiced as a board-certified sleep medicine specialist since 2009. So let me turn over the webinar to Joel and Elizabeth now.
Hi, everyone. This is Joel Nigg. I'm going to start this off, and then the second half will be Dr. Super. So I first wanted to just summarize kind of the high points we're going to cover today. We are going to, as Wayne pointed out, everybody knows sleep is important, but we're still going to highlight a couple of reasons why it's especially important for kids that you may not be aware of, just to help, and it may help connect the dots for some of what you're seeing with questioning whether sleep and ADHD are related. We're going to talk about the amount of sleep, just kind of the goals that we had, just to refresh us on that, and then review the common sleep problems that are behaviorally related, which many of you are probably all too familiar with, and then some guidelines both for routinely making sleep go more smoothly, and then what to do when that doesn't work. And finally, how to know when it's time to go beyond treating this as a behavioral issue and going to a formal full-on sleep evaluation with a sleep specialist. Most of our talk is going to be about children and teens, but it's only a few changes to this material to make it relevant to adults, and we can certainly expand on adults if that's a key question during the Q&A period as well. So one thing that has been popular in the media lately is a re-recognition or a re-popularizing of the idea that sleep and ADHD are connected. While this has been known about for decades, it every so often becomes a hot topic, and that's true certainly today. We see headlines like this where a new study comes out and the question of, is ADHD really maybe a sleep problem? And we'll talk about that in a minute, but I always, in all my webinars and talks, I caution against any one single theory of ADHD. Just a reminder to all of us that ADHD has many sources, and it's quite possible that one subgroup is kids with sleep problems, but we don't want to oversimplify and try to reduce everything down to that. But we don't want to miss a sleep problem when it's involved. So let me say, so we're obviously going to go from that now. Here's another key headline, and it's the same story. If sleep is the issue, let's make sure we solve that. And it's important to highlight this because it can happen and has happened many times where you will go in for an evaluation for ADHD and the question of sleep simply won't be thought of in the evaluation, and it's a blind spot sometimes for clinicians in how we train clinicians, and certainly part of the reason we're doing this webinar is we just think it's important that sleep not get overlooked, and that we kind of want to validate to some extent this popularizing. It is important not to overlook sleep as a possible hypothesis for the problems. Let's give a little bit of the science on sleep, just some headlines from the literature. As Wayne pointed out, sleep is a challenge for all of us. In fact, the statistics are rather startling that something like 70% of us don't get enough sleep. And I think probably if I asked if we could all see each other, we'd all be raising our hands saying we aren't sure we get enough sleep. The second is that in the case of ADHD, it's actually not true that most kids have a biological sleep disorder. Some do. It's a little bit above random chance there, but it's unusual for it actually to be the true root cause. Not unheard of, but it's not likely from the literature that all the kids with ADHD, or even most of them, actually have a true biological disorder, although we're going to talk about those in a little bit. But that said, it is true that it's very, very common. In fact, probably a majority of kids with ADHD do have some kind of sleep-related problem. Behaviorally related sleep disruption, this is called, where the sleep problems are secondary to the ADHD. However, they then make it worse. So you get a vicious cycle going. And that's the key take-home point here. Sleep can interact with ADHD, make it worse, and in turn, ADHD can make sleep worse. I'm going to come back to that in a minute, but first I want to say a little bit about the value of sleep. We already know that if you don't sleep well, you don't have good attention, and we'll show some data on that in a minute. But what's less well appreciated is that how important sleep is for learning. Many of you have probably had the experience of your child with ADHD getting something in school on Monday and having to start all over on Tuesday, not remembering it. And one possibility is that's because they didn't sleep very well. One of the myths about sleep is that not much happens during sleep. But I first want to go over how much sleep we really need. Now, these numbers that may shock you, kids need a lot of sleep. And when you back it up to what we're going to talk about in a minute, to the idea that we really would like to have a good, casual, nice, relaxing bedtime routine, the bedtime start times start to be something that a lot of us are going to shake our head and say, how can I ever get that to work? I just can't get that going that early. There's too much to do. So this is a challenge for all of us, but it's important to notice kind of what the ideal target would be and then work back from that and think about how close can we get, what can we manage? And of course, one of the challenges for all of us is that school start times are early, especially for teens. I'm going to say more about teens in a little bit. So let me come back to this myth that nothing happens during sleep, or that sleep's not important. It is important for attention, but it's also important for learning. The reality is that kids learn as much during sleep as they do when they're awake. Sleep is when learning is actually consolidated. These are just brain imaging studies, and this is just this little brain scan. What's interesting about this, it illustrates this kind of classic study from over a decade ago, is that when kids do brain scans while they're learning something, say some vocabulary words, then when their brain is scanned while they're sleeping, the same activation pattern is happening while they're sleeping. Now it's happening during the learning task. What this implies is that the brain is rehearsing the learned material during sleep and storing it. And there's now a large body of research in animals and humans, both in adults and kids, demonstrating that during sleep, material that was learned during the day is consolidated and stored in memory. So part of the function of sleep is to store learning. Going back to that for a minute, there's actually some studies in preschoolers showing that preschoolers who took a nap after being taught something new learned it better than preschoolers who stayed awake and kept practicing it. So there's actually an active role for sleep and learning. This is just kind of to motivate us, but it's also to help recognize, if my child isn't remembering what they learned, this may be an additional warning signal to think about sleep. This is just a study that was done very recently. Actually, this was just presented at a meeting I was at 2 weeks ago by the lead scientist on this paper, just demonstrating the causality. There's been controversy about causality. Is sleep really causing attention problems or just correlated with it? You've all heard that correlation is not causation. This study actually did randomly assign kids to have their sleep restricted or to have it extended for a week. and then got teacher and parent ratings and self-ratings. And they did show that by random assignment, where you have causality, you can make a causality conclusion that inattention and opposition was worse after reduced sleep. And interesting sluggish cognitive tempo symptoms, but not more hyperactivity. So this may be a sign that when you are seeing sluggish symptoms, your child doesn't seem very alert, or they're especially irritable, that may be another yellow warning light to think about, are they sleeping adequately? So the bottom line here is it's kind of this bidirectional relationship. ADHD symptoms can make sleep worse. Poor sleep can make ADHD worse. And there's an entire behavioral dynamic here to think about before we even get to the medical conditions that can drive sleep problems. So what are the sleep-related behavior problems? The American Academy of Sleep Medicine actually lists these in their diagnostic manuals, and clinicians can identify these as targets for intervention. And there are counseling interventions for these. And again, for many of you, these will be all too familiar. The child won't fall asleep without special hard-to-achieve criteria or conditions. Sleeping is something the child just doesn't want to do. They don't like going to bed. For some reason, they've developed a negative association that they don't like to sleep. They wake during the night, and they won't go back to sleep without you getting up and going in there and doing something. And this becomes a habit that is hard to break. Or there are other kind of problems with setting limits around sleep. The child can't fall asleep, or they can't stay asleep, or they stall their bedtime, or they get up during the night and won't go back to bed. So these are the most common problems. And the first line of defense is to see all of this as a behavior, as a behavioral issue that can be handled with behavior, just like you would handle other behavioral issues like refusing to eat or not listening or any other behavioral problem that you may have. Thinking about as a parent or even with yourself in terms of our own habits that we all have. It's a behavior to start with, and how do we approach that behavior? And then we go back and think about the medical side. So I'm going to do this in two phases. First, what are kind of the basics of good sleep hygiene, we call it, just good habits to help sleep go well for kids. And again, as with minor changes, a lot of this applies to adults. And then we'll go on to when that doesn't work, what to do. So first of all, the basics of what's called good sleep hygiene, just good sleep habits or good sleep practices for kids. And the way to think about this is to think about boundaries around sleep. Sleep is a special action that we want to learn to do, and it has boundaries around it on time and around space. The time boundaries are to think in terms of a period of time, 45 minutes to an hour before sleep, when you want some conditions to be positive for sleep. And there kind of are three big ones here that we want to remember. One is blue light. That means screens, phones, and video games. This blue light can interfere with sleep. I'll say more about that in a second. Heavy food or heavy meal right before bed can make it harder to sleep. And vigorous exercise can make it hard to sleep. This is something that I struggled with. For many years, I loved to go to the gym after supper, and then I couldn't sleep. And I finally figured out that a lot of exercise in the evening makes it hard for the body to quiet down for sleep. So like an hour break before any hard exercise, and then just generally having a quieting down process for that hour. So thinking about that time boundary around sleep. And the second is a space boundary. And again, it's hard to do this for a lot of you. The child's bedroom is the only place where things can happen. There may not be room in the bedroom to do everything. But when possible, the ideal is that the bed, at least, is only used for sleeping. And that if the child is going to play or study in their room, that they don't do it on the bed. That's kind of the ideal. And so that way the brain is learning that when you're in the bed, you sleep. That's kind of the behavior that the brain associates. It's kind of a stimulus response kind of thing that we want the body and the brain to automatically learn. In the ideal world, if we had unlimited room, we would have the entire bedroom only be for sleeping. But I know for a lot of us that's not realistic because the child needs the bedroom for other activities. But at least if you can, try to aim for only the bed to be only for sleeping and to do other activities off the bed to the extent you possibly can. So these are the space boundaries and the time boundaries that are our general principles around this. Let me say another word about the blue light. There's actually a physical basis for this. The body has hormone responses that are light dependent, and there's actually a clock in the brain. It's in a brain called the suprachiasmatic nucleus that responds to light, and this is actually trained in babies. The brain entrains itself to light, And unfortunately, the screens that we use on our computers and in our phones fool the brain into thinking that it's not time to go to bed, and the hormone production that's necessary for sleep doesn't happen. So we want to ideally avoid those screens for that hour before it's time to go to bed. Now, there is actually some research that if you filter the light on your phone or on your computer with an orange filter and take away the blue part of the spectrum, that you can avoid this problem, that the hormone changes that are necessary for sleep will not be disrupted. But and so that you can do that if it's just not possible. But you can go that route. But it's really better to try to just get the screens away for that last hour. And I know we could have a whole webinar on screen addiction and the challenge that I know many of you have with your kids, especially your teens. But that's the goal. So what are some action steps here? And I go over this in detail. Just a little brief plug for that book that Wayne mentioned on getting ahead of ADHD, where I have a whole chapter on this. But just kind of some headlines here for key hygiene behaviors. First up is set up a routine, so it's not just sending the child to bed, but having a 30 to 45-minute gradual process here of getting ready for bed. Keep that routine positive. You want to end on a positive note. This gets to the issue of the child sees bedtime as something negative and sees sleep as something negative. And then one of the behavioral challenges that's hard for many of us with our kids is helping them keep moving forward. The child wants to stall out, they'll stay in the bathroom too long, or they'll get sidetracked. So a little bit of that needing to redirect sometimes, especially if the child has ADHD, keeping them engaged around, okay, now keep on doing the next thing that you're supposed to do, even while they're talking or telling a story or whatever. And then it's nice to end with some kind of positive ritual that the child enjoys. A lot of you are already doing this, maybe telling a story or reading a book, singing a song, saying the prayers, maybe doing a memory of the best part of the day. And that can be a little bit of warm, intimate, fun, nice time. But the idea here is to create a really positive association. Again, we want the child's brain to learn that going to bed and sleeping are where something nice happens and it feels good. That's kind of the learning we want the child to have, and try to get out of that experience that sleeping or bedtime is somehow negative or unpleasant. And then ideally you end with the child drowsy and saying goodnight, but you don't have to wait till they go asleep. In fact, one danger there is that the child unconsciously learns that they can't fall asleep unless their mom or dad is with them. And we don't want that to be the learning. We want them to learn to fall asleep by themselves. But so if this is an issue, we can talk about how to solve that. But what you're going to try to shoot for is getting to the point where you can leave the room when they're still awake, but they're ready to fall asleep shortly. All right, a few just additional comments on this that are kind of interesting. It's important to have this routine be the same. Again, we're talking about building habits here, having this be automatic and unconscious. This is not something we want to be a lot of effort. We want it to just kind of be automatic and natural, that just kind of happens without a lot of struggle. And that's probably making the habit, having it be the same, so the brain and all of us in the brain learns to just how it is as an automatic association. And then when you get into a situation where you've got the child in bed, but then they call you back or they get out of the room, what you want to do is try to avoid rewarding that with a big positive interaction, and instead try to keep that engagement to the minimum and redirect them. Again, think of it as a behavior. Time to go back to bed. We'll talk about this tomorrow. I've got it memorized. We won't forget. Whatever is you need to say to help them as promptly as possible move back to the behavior they're supposed to be doing, which is going to sleep. And again, this is not a time for punishment. However, keeping it positive. You did a good job getting into bed. Let's go back to bed. It's time to sleep. And then we'll talk in a minute about the behavioral plan you'll need to put in place if this isn't enough. But you can, again, treat this as a behavior and develop additional positive rewards for going promptly back to bed or staying in bed. Some parents find it helpful to write out the bedtime schedule. First, we're going to brush our teeth, then we're going to change into our pajamas, etc. Then we're going to tell a story, and kind of so the child knows what to expect. For very little kids especially, this is sometimes helpful. It's not something you have to do. It may make it harder to do it in some instances, but for some parents, that's been a nice little trick to do. And then occasionally, or more than occasionally, if this isn't enough, if just doing this routine, if you're already doing this and it's not working, then it's time to think about, okay, I need to put in more of a structured behavior plan here to get back on track. And maybe I need a little bit of counseling to make sure I can do that. So what happens when the routine doesn't work and you've got a problem to solve at the behavioral level. One piece of good news here, there's a couple of studies recently that are very encouraging. Counseling around sleep is extremely effective. It's quite straightforward for professional counselors to troubleshoot what's happening in your sleep routine and to give you the tips that you need to fine-tune your plan for the bedtime. And there's a nice literature now showing that even a couple of counseling sessions with a sleep counselor, behavioral counselor on this and can get you back on track. So the good news is this is not something where you need a year of counseling. Often you can get it back on track fairly readily with the right modifications to what you're doing behaviorally. And then the principles here in any program are, first of all, treating going to sleep as a behavior. Don't think of it just as something the body does by itself. Think of it as a behavior that you want the child to learn to do, just like they learn to do their table manners or other behaviors. And you can create a behavioral system for it, just like any other behavior, where they get points for going to sleep or points for going to bed or so on. And then the principle is all of this is going to be somehow fading in toward the behavior you want. It may be too big of a leap to go directly from child is up for an hour every night to straight to staying in bed, but you gradually want to move toward that by incremental goals, and that's what you map in behaviorally. And then as you get in with the counselor, there's a number of technical methods for doing this. Here's some of the terms that are used in the counseling literature: building toward sleep with positive routines, using what's called unmodified extinction. That's a fancy phrase for toughing it out, kind of suffering through the uncomfortable period before it's time to fall asleep. But there's also kind of these graduated programs where you keep it positive, give the child success, and build toward incremental goals to where they're getting closer and closer to the kind of sleep routine and sleep quality that we want. And then one of the key challenges is having the child go to sleep by themselves and gradually fading out your presence as a parent during the going to sleep process. And again, that's something you want to do gradually. You don't want to cut cold turkey with your comforting during sleep time. If the child is needing too much of your time and attention during sleep, you don't want to take that away all at once, or it's just painful for the child. Rather, you want to phase it out gradually in a very positive way so that it feels positive every step of the way for the child. And that's where a good counseling can really help to get that dialed in very effectively. And there's a number of ways to troubleshoot this when it's not working, and we can touch on that a little bit in the Q&A if needed. But often it's very individual specific to what's happening in your particular circumstance. The important point here is that all these different methods are about equally effective. It's not critical that your counselor use one method or another, or that you do. You can choose the method that feels right for your parenting style, for your personality, and then just target it to the specific problem that you're having, whether that's getting out of bed during the night or not wanting to go to bed or whatever it may be. So these are the general principles that the counselor would work with and help you to implement. And again, it can be done fairly readily. These are pretty easy methods for you to implement once they're taught. A couple of tidbits. I'm going to skate by these quickly in the interest of time, but an interesting twist is sometimes a pleasant smell will improve sleep and learning. That's something that you can think about for interesting tips and twists in this. But I want us to be able to move on here now to what to do when none of this works and how to know when it's really time to get a formal sleep evaluation with a sleep specialist. So I'm going to invite Dr. Super to take over here and to step in and walk us through the medical side of this, where sometimes it really is a true medical problem that you have to be able to get addressed.
Okay, thanks, Dr. Nigg. That was really great. So questions kind of, when should I get a formal sleep evaluation? And that's what I enjoy doing as a general pediatrician as well as a sleep medicine specialist, kind of helping families and children get more sleep. So when we think about sleep, kind of in the most common cause of sleepiness, especially in teens, it's actually not a primary medical issue. It's exactly what we were talking about, not enough sleep. And I think as Dr. Nigg mentioned, it is very tough for adolescents to get adequate amount of sleep, which the recommended amount or even dose, if we're thinking about how important sleep is for ADHD symptoms, is about 9.25 hours sleep. So with early school start times, kids having to get up at 6 a.m., potentially getting to to bed at 9 a.m., which is very difficult for teens, as more physiologically they may be set for their body clock to be later. I like to talk to parents about common sleep stealers, though, and those, if you think about your child is sleep deprived during the week, or even more times when your child's not getting enough sleep, and that can be on weekends when the thought is, oh, it's Friday night, Saturday night, why not stay up late? Really, that's a sleep stealer for your kids that are already probably chronically sleep deprived. If they're spending times at different households between parents who are co-parenting, making sure that the sleep routine is similar in both of those houses. So besides not getting enough sleep, if your child is getting enough sleep and they still have these symptoms, this is a red flag. And the most common primary sleep disorder we see, especially in school-age kids between ages even 3 to 8, is obstructive sleep apnea. Symptoms can be snoring that's persistent, so more than 3 days per week. So not just when your child's sick, but snoring, possibly very loudly, very routinely. Pauses in breathing. If you're really hearing kind of a choking, a gasping during sleep with snoring, that is abnormal, and you should absolutely be talking to your primary care provider about that. Sometimes kids mouth breathe during sleep. They're sweating during sleep because sleep apnea is really a cessation or a stopping of breathing during sleep because of significant obstruction, and that obstruction during sleep can cause them to really work hard or sweat during sleep. And again, the red flag, if your school-age kid is actually getting 11, 12 hours of sleep, but they're still sleepy, something is not normal, and further evaluation potentially for sleep apnea is indicated. And I think, as we know, school-age kids, if they don't get enough sleep, they often are not sleepy. They're more hyperactive, inattentive, have more impulsive behaviors. For sleep apnea, obesity is a significant risk factor, so something to think about. So again, big red flag warning of sleep apnea, snoring, pauses in breathing, mouth breathing, or sweating during sleep. So if you have those symptoms, talk to your primary care provider, and a referral to a sleep medicine specialist is definitely indicated. And beyond that, they may order something called a polysomnogram, or an overnight sleep study, which is a non-invasive test. There's no radiation, there's no blood draws, but there's simply measurement of brain waves and breathing during sleep at night. And the good news for sleep apnea is if we can find it, we can treat it. And there are treatments that have been effective for kids. For mild sleep apnea, could be some allergy medicine, some topical nasal steroids. More invasively, could be surgery, removing the tonsils if indicated, and then a CPAP machine, especially if there's obesity or kids are older. So thinking about sleep apnea, as Dr. Nigg said, sometimes providers kind of forget about asking about sleep in kids with ADHD, and really thinking about your child if they're snoring during sleep. So another red flag, another primary sleep disorder, is something called restless leg syndrome. And this is not something that's occurring during sleep, but can be a symptom that's contributing to insomnia or difficulty falling asleep. And it's these symptoms. There's no blood test for it, but it's a symptom of urge to move the legs, worse at times of rest. And those are a lot of our kids with ADHD, right? They're hyperactive, they're fidgety kids, but really these symptoms can be worse later in the day that are from restless leg syndromes, and they're relieved by movement. So evaluation for restless leg syndrome, again, referral to sleep medicine specialist. Again, if the symptoms disrupt sleep. So many of our kids are kind of hyperkinetic or moving a lot or fidgeting, and that kind of helps them concentrate. But these are really symptoms of restlessness that are impeding their ability to fall asleep, and the symptoms can be very different. It's also difficult for kids to really relate these symptoms to us. We can use further questioning from a qualified sleep medicine specialist, or even validated symptom rating scales. And again, the good news with this, if we diagnose restless leg syndrome, there are some adequate treatments that can help kids be less restless at night. And there's been a big correlation between iron storage levels and restless leg syndrome. I think there's more research coming out around iron storage and also ADHD. So we would measure the iron storage levels. We'd possibly get a sleep study to see if these leg movements are occurring during sleep. And then we really try to target the symptoms with non-medication as well, potentially heating pads, relaxation devices, and if there's low iron levels, we can supplement that. So thinking about symptoms prior to sleep that may be contributing not only to the behavior behavioral insomnia that Dr. Nigg talked about, but actually restlessness. How about our teenagers who have very, very extreme insomnia? There's a condition, this is a circadian condition called delayed sleep phase syndrome. And these are patients that are extreme night owls, and so extreme they may have difficulties falling asleep prior to 1 to 3 a.m. Well, these may be, as maybe these adolescents grow up, these may be the great people that are working night shift or swing shift, and it's not really affecting their daytime life. But unfortunately for adolescents, they have significant daytime dysfunction because school starts at 6 or 7 a.m., which actually is in the middle of their sleep cycle. So imagine someone trying to wake you up at 2 or 3 in the morning, how you may be functioning at that time. Really hard to wake up. You may miss work, or in this case, kids may miss school. There's mood difficulties and academic decline. So again, they're asking to be performing and cognitively alert, maybe in the middle of their sleep cycle. So they have difficulties if they're needing to wake prior to 10 a.m. If the children or adolescents are able to be on their own schedule, let's say sleeping 1 a.m. to 10 a.m., there's no primary sleep dysfunction. They wake up rested, they're functioning well, but if they're not on their desired schedule, they have these significant dysfunctions. So this is delayed sleep phase syndrome. It's a circadian-based disorder where we know that their circadian rhythm is delayed or later, and because of this, they have significant difficulties functioning. So these kids are the ones who really do well in the summer. They set their own schedule, they sleep well, they're productive, maybe behavior is going well, but during the school year there's a lot of disruption. So evaluation for this, kind of thinking about, is it a circadian-based rhythm disorder, or is it some of the sleep hygiene issues that Dr. Nigg talked about? We want to make sure that teens aren't just delaying sleep because they're exposing themselves to media. They're very active prior to sleep. Let's say they have sports very soon before their sleep time. They're staying up to socialize. There's excessive homework. We really want to understand their sleep pattern, and we can fill out further sleep diaries or even do recordings of sleep. This is an ActiWatch that's a validated motion sensor for sleep. It's not a Fitbit, which there's many commercial devices out there that may say that they measure sleep. They really may measure motion during sleep, and we know that sleep is an active motion. It's an active process. So really, if we want to have a marker for sleep, we recommend that you do see a sleep medicine specialist and use a device that's actually validated to record sleep. For patients with delayed sleep phase, we still have to maximize this healthy sleep hygiene. We have to have routine sleep scheduling. And occasionally then we will kind of have a therapeutic, a treatment that slowly moves the bedtime earlier with use of low-dose melatonin and some early morning light. This is quite difficult for both teens and families, but I want you to be aware that it's not just lazy teenagers that maybe can't go to sleep, that they may have a real biologic or circadian-based reason why they're having trouble sleeping or even waking up in the morning, which is what we really have the most difficulty with. So how about medications? I wish there were medications that would be an easy fix for all of our kids' sleep and our teens' sleep, but really there are no FDA-approved medications for sleep in children or teens. So any medications that you're using, whether it's over-the-counter, like Benadryl, Tylenol PM, or if it's supplements like melatonin, none of them have reached the level where they're FDA approved for sleep in children or teens. Even if your provider is prescribing something for sleep, again, it's considered kind of off-label. There is evidence to support melatonin use in children with ADHD, but there's few long-term studies. So it's something that we want to study more, but we just don't know. Patients who maybe have been using melatonin for 5 or 10 years, there may be side effects that we just don't know about. So I always caution parents if they come in to see me, what happens when you don't take the melatonin? Do you really need to take the melatonin? How long have you been taking it? What dose are you taking it at? What time are you taking it at? And what preparation is it? Because it's a supplement, and again, there's no reassurance that what it says on the bottle is what you're actually taking. And that's a supplement for kids throughout development that have very vulnerable brains. So I just want to caution the kind of casual use of melatonin. That being said, we're trying to study it more, and in certain patients with correct use, it has been helpful, especially in kids with ADHD. Some of the ADHD medications can make sleep worse. So stimulants that have been shown to be very helpful for ADHD sometimes can make sleep worse. So this is a conversation that you need to have with your provider to kind of think about what time are you taking your stimulants, how long are the stimulants lasting, when are they kind of starting to wear off, is it making sleep worse? We also know that some stimulants can improve sleep in patients with ADHD. So really talking to your healthcare provider is super important. So just want to close. We kind of talked about the primary sleep disorders and things that you may want to kind of think about with red flags. That was obstructive sleep apnea, restless leg syndrome, and delayed sleep phase syndrome. But overall, our take-home message is youth with ADHD do have sleep problems that can make it worse, and it's really that bidirectional relationship. Occasionally, a real sleep disorder can cause apparent ADHD, but most of the time, that's not it. Like Dr. Nigg said, it's very complicated. We don't want to simplify things, and we really want you or your child to get the most individualized care. That's the most important thing, is for someone to really work with you individually. First line approach to sleep problems is really behavioral sleep management. We have lots of evidence for that. And to consider primary sleep disorders in children and teenagers presenting with ADHD with primary inattention. Last resort is medical intervention after a primary sleep evaluation. All right. Well, that concludes kind of the end of our slides.
Okay. Well, lots of people asking about adults with ADHD and sleep challenges. Is there anything you can add to that to help the many people who have asked that? I mean, the amount of time they should get in terms of sleep, and are the challenges for the teens and the kids the same for the adults? And
first of all, yes, a lot of the same issues hold for adults. And certainly for some adults, a big challenge is getting yourself to actually do these behaviors that you know you should do, but they're hard to do. So actually getting yourself to bed on time, getting yourself up at the same time every day. So certainly for adults with ADHD, the first line of defense is to try to get those sleep hygiene practices going. Get your bedroom quiet and dark. Only use it for sleep or sleep or sex, obviously, in the case of adults. Go to bed at the same time every night. Get up at the same time every day, even if you don't think you slept well. Avoid exercise and heavy meals, and avoid your screens in that hour before bedtime. Hard for all of us because we have so much to keep track of on our screens. And if you really feel like you slept all night and still are tired, get that evaluation for a possible primary sleep disorder, consult your physician. But I think for adults with ADHD, the biggest challenge is that if I'm an adult with ADHD, it's just hard to discipline myself to do the things I want to do, the willpower, and that's really the big challenge, is how to motivate myself to do it, and think about how to reward yourself with something really positive in the morning that makes you want to go to bed, or something really positive at night that makes you want to go to bed, so that you can get yourself to bed and get yourself up. It can be helpful to have a light alarm. A light alarm helps you wake up. So there are alarms now that'll turn a bright full spectrum light on at the time you set, and do it gradually. That may make waking up, help your hormone function, get back on track a little bit with the early morning that you have to get up. So that's kind of the general principle. But yes, a lot of this will apply to adults the same. And the only challenge is you don't have a parent to help you. You got to do it yourself, and that's a big challenge. And there's also, of course, the challenge for adults who are married or in a partnership or a relationship where your partner might not have the same sleep schedule you do, and that becomes a difficult negotiation as well, of course. Let me just give a second in case Dr. Super wants to comment, and then I know you've got a lot of other questions for us.
Mm-hmm. Yeah, no, that was great, Dr. Nigg. I think this medication story is similar in adults as children, and the first line treatment based on good research now is cognitive behavioral therapy for insomnia in adults. It is not medication, and I think that is so hard because it's easier to think you can take a pill than to change your behavior. So I just want to reinforce that, and also put a plug in similar to what Dr. Nigg said, is that cognitive behavioral therapy for insomnia in adults is effective. It can work, and it may not take very much time. It may maybe a three to four sessions of behavioral therapy for adults as well. So these are hard things to change, and I think more and more we're learning that medication is not the answer.
Mm-hmm. A couple of general questions. Why are so many people with ADHD struggling with sleep? Is there some link that science or research has indicated or suggested that an inordinate amount of people with ADHD, kids and adults, have problems with sleep?
It's certainly true that it's a high percentage. There's no question about it. And a lot of this is because of the symptoms of ADHD exacerbate all the things that make sleep hard for all of us. It's naturally hard to sleep in our culture because we're so busy, we have so much going on, we're so overstimulated, we have media, we have to get up for school and for work. It's very hard to get that kind of relaxed pace that facilitates natural sleep. We have artificial light, we have artificial noise. And for ADHD, it's all double down, because if you have ADHD, you're hypersensitive to these environmental stimuli, you're more sensitive to all these inputs, your body reacts more strongly to stimulation, you're more hyper aroused by things that happen during the day, it's harder to turn your brain off. So all these features of ADHD around regulating our mental state that are so hard with ADHD just makes all these challenges in our society kind of doubles the challenge. And so I think it's just a natural side effect of what ADHD is, that something like sleep that kind of requires the opposite energy of the energy that ADHD provokes is naturally difficult. And that's why it takes a kind of deliberate attention, a deliberate behavioral strategy, or a deliberate kind of tackling of this so often for those with ADHD. Whereas for those who are lucky enough not to have these issues, it just kind of is automatic for sleep, and they don't know how lucky they are compared to those who struggle with sleep.
Mm-hmm. Does a lack of sleep interfere, for instance, with neurotransmitters in the brain? Do we know that yet?
It's certainly true that if you don't sleep, it's going to change hormone functioning, and that's going to have downstream effects on neurotransmitters. But other than knowing that sleep affects attention, but I think the story of how that might relate to ADHD symptoms, for example, does poor sleep change your dopamine functioning? I think that's all still being developed, but it's certainly the case that the sleep hormones are going to interact in some form there. Serotonin, for example, is a big one for ADHD and sleep. So I think that story is going to unfold.
Mm-hmm. What is a lot of people have asked, what is a typical CBT session in adults for getting more sleep? How does that work? Could you walk us through what a therapist might do?
A typical CBT session for sleep in adults would be, first of all, you would outline the behavioral goal. What is it you want to try to do? The first challenge. So maybe the first challenge is, I just can't get myself to bed on time. I know I have to go to bed early if I'm going to get up early and to get enough sleep, but I just can't get myself to do it. So in the cognitive behavioral therapy, you're going to work on two things. First of all, making sure that goal is really well defined. Okay, let's make specific. What time do you want to go to bed? I want to be in bed by 9 because I know I got to get up at 5. Okay, that means what time do you want to start cooling down your day, winding down your day? Okay, that means you got to turn everything off at 8. You got to start dimming the lights at 8, turning off the media at 8. Okay, now my problem is I can't get myself to do it. Okay, let's talk about the thoughts you're having that keep you from doing that. What thoughts are you having? And then you start to examine, well, I just don't believe I need to do it, or I just don't feel like I can afford to stop working. And you start to examine and challenge those thought patterns so that you get yourself motivated. And it's kind of then a process of teaching yourself to talk yourself down from those false beliefs that keep you from taking this positive step for yourself. And then that'll kind of iterate through the obstacles until you've nailed all of them.
Okay. A couple of questions about products. Do those blue light glasses, are they effective? And a bunch of questions about weighted blankets. Do you have any research or thoughts or opinions on that?
Yeah, the blue light glasses or blue light screens that filter out the blue light can be effective. There is a little research showing that if you can get the light to be the orange spectrum or not the blue spectrum, that it will alter the hormone functioning that's disrupted by blue light. The challenge there is it's not as effective as not having any light at all. It's only partially effective. And then, the weighted blankets for kids do help some kids and adults to sleep. There's a little bit of research, but it's very preliminary. So certainly anecdotally, a lot of people have had that experience that a weighted blanket can somehow comfort a child. And for very young children especially, in particular cases, it's very calming. So there's a little bit of work on that. I think it's valid to consider that. I'm going to give it to Dr. Super to say more about the glasses.
Yeah, I just wanted to mention with media, it's the light exposure which is significant. We know is physiologic, as Dr. Nigg said. The light goes through to our retina, into our pineal gland, and actually physiologically decreases our melatonin. So if you're giving your child supplemental melatonin, which we have no idea really the doses and how it's going to affect them long term, by using media, you are actually physiologically decreasing their own endogenous or their own body's melatonin. What's been interesting, too, is kind of something that we know that media is actually stimulating, too. So they've done studies now. It's been adults who were exposed to kind of some internet content or similar Facebook content prior to sleep. And it was not just the light exposure. It's not just the light exposure, but it's the stimulation of the media content. And I think that's super important to know, is that you may think about, okay, blocking the blue light for your children in the screens, but the content is still significantly stimulating. And that's blocking their ability to start sleep and relax into sleep. So when parents ask me, do blue light glasses work? They may work for that one piece of the problem, but they're not going to help the body and the brain really relax and start sleep. So I really try to avoid them. I really try to work on what can we do as a family? What are some of the behavioral interventions we can do to get the screens out of the bedroom, to model this as parents? So as parents, we also need to say, hey, I'm not bringing my phone into the bedroom. We're all charging our media in one place in the kitchen. That's how we're going to be healthy during sleep. It's really not that the child's in trouble or it's a punishment, but how are we going to get you healthy? How are we going to get you functioning the best during school? I talk to my athletes about increased sleep can help their athletic performance. It can help your mood. It can only help your functioning. So I really don't like to recommend blue light glasses. The case that I do recommend it is adults who are shift workers and they're coming home, they're driving back home in the morning, and they're being exposed to all that natural sunlight. Use of blue blockers at that time has shown to be effective to help their body produce melatonin at a time that it's not going to usually. So I'm going to pass it on.
Mm-hmm. What about for adults? I would imagine the same thing applies in terms of the stimulation level. A lot have asked, what about reading before bed? A lot of adults have experienced, as they read, they fall asleep. So the same thing sort of applies. Make sure that the material you're reading is not too stimulating.
Yeah, the same question for adults. Is it just too stimulating to be using stuff before bed? Yeah, the same principle applies. And the question about reading before bed, I think is very relevant. Sometimes reading is very relaxing. It takes your mind off of your day and it helps you to relax. But I think, as was implied by the question, if what you're reading is getting you super stimulated, super aroused, super excited, super angry, right before bed may not be the time to read that blog with the inflammatory political commentary that's making your blood boil. But it may be a time to read an enjoyable escapist book that may help you relax a little bit. But again, I would recommend don't read in the bed. People like to read in the bed, but you want the bed to be for sleep. So think about reading in a chair next to the bed or reading right outside the bedroom and then getting into bed when you're feeling drowsy. And that's kind of the trick there.
Right. What do all of these recommendations apply equally to kids and adults diagnosed with inattentive ADHD as well as hyperactive ADHD? Are there any differences or distinctions or additions you'd like to make?
Essentially not. I think that if the child has inattentive ADHD or hyperactive ADHD, the recommendations are going to stay largely the same. The difference will be in the details. The particular behaviors that are interfering with sleep may be different depending on the pattern. So the inattentive ADHD kid may be having trouble following through on their routine. They may be doodling around so long in the bathroom that you can't get them moving forward because they're not focusing. Whereas with the hyperactive kid, it may be that they, are jumping back out of bed for something they just thought of. So the specific behaviors may be different that you have to address, but the general principles of getting that behavior program working are going to be the same across the board. I will say, though, that it's interesting in that adolescent study we cited that poor sleep provoked worse attention, more inattention, but not more hyperactivity. So I think really as far as the warning signs go, the one caution is when inattention and irritability are much more prominent rather than hyperactivity, that's an additional flag that have we ruled out sleep problems. But that's about the only difference I would make.
In terms of sleep apnea, the connection or link between sleep apnea and ADHD, several people have said, well, 1 year I was diagnosed with sleep apnea, and the next year I was, diagnosed with ADHD. They want to know the correlation, if there is any.
Okay, so the question was kind of, is there, what is the correlation between ADHD and sleep apnea? What we see is that symptoms of sleep apnea can mimic similar symptoms of ADHD. So patients with sleep apnea, because their sleep is disrupted, can have hyperactivity, inattention, impulsivity, especially in that school age group. So the converse of that is you could have both sleep apnea and ADHD. I think what's really important is if you have symptoms of sleep apnea, that be evaluated and be treated. And sometimes in my patients, if they have diagnosed ADHD or more significant symptoms, I am more aggressive in treating the sleep apnea. So in some patients, if their sleep apnea is treated, their symptoms of hyperactivity, inattention, impulsivity, they may completely resolve. They may actually no longer have ADHD, or their symptoms may improve. So it's really a case-by-case kind of understanding of what's going on with the sleep and the sleep apnea. I often, if you have symptoms of both, some pediatricians want to have a sleep evaluation first before treating symptoms of ADHD, and that can get a little bit tricky. But I just encourage you to think about this is all pieces of a puzzle. And so one piece of the puzzle may actually be sleep apnea. We can get that treated, and hopefully the child will be functioning better after treatment. What they found, and there's been pretty good studies, is that especially in some children, again, treatment of sleep apnea may have a good resolution of ADHD symptoms or complete resolution, but it really is a case-by-case kind of intervention. Again, just kind of thinking overall that sleep is so important in kind of functioning for kids and adults.
Yes. Several adults have brought up the fact that they have some real problems in terms of the stimulant. While it helps them manage symptoms, they're going back and forth a lot with their practitioner about dosages or when. I mean, that can be a complex problem, right? It might take some conversation.
Absolutely. So the benefit of stimulants versus the side effects. And so seeing your provider, knowing that, hey, stimulants are short acting, you're going to kind of know how you're reacting to stimulants in 1 or 2 weeks. It's not something you should wait on. And if you're having side effects, sleep side effects, that's something you need to go back to your provider, because there are different stimulant preparations. There's different stimulant types. There's stimulants that are short acting or long acting. So really talking with your provider and not suffering with that is something that you should really do and advocate for.
Does the patch come in terms of being helpful, being able to take it off? And
I think again that's another tool in our toolbox, is a patch that can have kind of some long, more long-acting medication for kids, and that's something that may be used. So again, talking to your provider, it can be an option. It can be beneficial. I'm going to pass it on to Dr. Nigg.
Joel, do you have more to add?
No, go ahead. I'm good on that one.
Oh, okay. Because the hour is about up, so we'll have to have you back again. This is great. I mean, there was so much material to cover. Thanks for being here, Joel and Elizabeth, and sharing your expertise.
It's been a pleasure, so thank you for having us.
Once again, today's webinar sponsor is Sonic Alert, maker of the Sonic Bomb alarm clock. Never sleep past your alarm clock again with this extra loud alarm and powerful bed shaker. The dual alarm clock has been proven to wake up even the heaviest sleepers. If you want more information about it, the URL is sonicalert.com/alarm-clocks. So have a great day, everyone.
For more Attitude podcasts and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com.